not to move off to that topic or anything, but I was also wondering if a patient has tissue already, and is that going to affect the way if you want under the muscle or over the muscle? Like if somebody has no tissue already,
Right.
and they want to get larger breasts,
Right.
does that affect? Would you rather put them under, or do you have your opinion on that, like the way they're going to turn out afterwards?
There are plastic surgeons that have gained some notoriety, and for using different techniques of measuring and evaluating the breast to determine whether or not, in fact, an implant could be put on top of the muscle. And a pinch test is what has been promoted as a means of determining that. And what one would do is just take a calipers and measure how much tissue can be pinched between the edges of the caliper. And if the tissue measures 2 centimeters or greater, these other plastic surgeons think that putting the implant on top of the muscle is okay. I'm not so sure that I agree with that. I think a lot has to do with the type of implant, how large it is, and most importantly, the body habitus of the patient. If the patient's a thin woman with thin tissues, you could sometimes pinch 2 or 3 centimeters, and it's still not a good idea to put that implant on top of the muscle. I think for aesthetic reasons and for the most natural appearance possible, the implant needs to go under the muscle, plus the muscle helps keep it in position like we talked about. There are, however, patients that directly or indirectly earn a living by virtue of their physical appearance, more specifically the appearance of their chest, such as your dancers. That can also be applied to cocktail servers and car dealers and bartenders and that sort of population. And it isn't a derogatory comment to say that. I mean, it's just a fact. And so if they can enhance their attractiveness by having breasts that are large and voluptuous and visible and so forth, then that could translate directly into a more secure income for that individual. So there's no shame in that at all.
Okay.